Certainly my research I've done over the few years at UBC looking at these populations has shown, for example, that there's a lot of abuse, sexual abuse, psychological abuse and things like that.
With some pretty horrendous childhoods, that people had. A lot of people had, a lot of the women were sexually, and men were sexually abused as children.
That's how they get into the cycle. They're introduced to things, and by using substances over time, as a way of ameliorating their pain, they become addicted.
Significantly beyond 50% have separate independent mental illnesses like mood disorders, so severe depression, or anxiety disorders, or other kinds of mental challenges. It's not about recreational drug use. It is about really a difficult situation, challenging situation in their life where they have to deal with mental challenges and where drug use is complicating an already very complicated life.
We go through life as a heroin addict being told every day how bad we are and how evil we are and how it's our fault that we're using drugs. And I think what happens then is we start to believe that.
What it does to the individual, it really reduces their sense of self. So if they had any kind of self-esteem, it's probably all destroyed now. And that just makes it that much harder to make them, to help them get better and into recovery.
And so we start to walk around believing that we are evil, we are bad, we are criminals, and all the whole thing that goes with it. Whereas we're really just damaged individuals.
Because there is very often the perception that they have just a weak moral constitution. They just need to decide that to change and to do things different, and not understanding that addiction and especially heroin addiction is a very difficult challenge, and it is going beyond just using a certain substance.
Stigma is one of those things that, I think we see a lot of it in the city of Vancouver still.
This is something we need to address and to change.